Hi, morning everyone. This is the Business COVID-19 webinar for offices. Just to let everybody know that the webinar will be recorded and we'll publish it after the event on the three council websites. Little disclaimers: views expressed are the speakers alone, don't necessarily represent UK government or bodies speaker represents. You'll hear a little bit of the science around virus transmission, that just to give you some context to some of the guidance you read or the views that you hear today. This is being brought to you by the Regulated Services Partnership, council-owned service. We're covering the boroughs of Merton, Richmond and Wandsworth. We have over 50 staff that cover the main regulatory bodies that you would come into contact with. And amongst the range of other consumer protection issues that we deal with and enforce is the COVID regulations. Now, just to put your mind at rest, because you may have queries now or after the event, we are here to support business. 99% of all our interactions are about giving business the right advice to get things right. I highlight that because we're conscious that some of the media suggests we're the business police. That's very much not the case. So if you've got a concern, got a query, feel reassured to give us a call and we'll try and help you as much as we can. Speakers today are myself, Paul Malosha-Ski-Reid. I'm in the Trading Standards section. We've also got a host of other council officers from Health and Safety, our Regulation Department, Economic Delivery. So between us all, we should hopefully answer all of your questions. So a little bit of an overview. We'll be touching on the government guidance, financial, mental health and other support available to businesses, practical steps to reduce the risk in your office premise, touch on PPE, touch on the queries that were posted around staff, what if staff have COVID and need to self-isolate, and then there'll be a Q&A with the panel. So just to highlight, everybody except the speakers are muted throughout. After the presentation, you guys will get a chance to ask your questions. If you want to, just raise your hand, press the raise hand button, and then you will be unmuted after we say your name. If you do want to speak, it's great if you can turn on the camera. And meanwhile, please just use the chat function to share your views, concerns, queries as we go, and we'll try and feature those into the presentation. So essentially, what every business has always had to do with any risk in your premise is to do a risk assessment. Every employer has this legal responsibility: protect your workers, protect your customers that come into your premise from any risks to their health and safety. So COVID-19 is a hazard, just needs to be managed like any other hazard that we have out there. Food premises have to deal with food viruses. There's a range of other airborne diseases. So these are things that some businesses will have more experience dealing with than others. You need to identify those hazards in your premise and then do a suitable assessment to look at the risks and how do you control and minimize those risks. Now, there is risk assessment templates that appear here, and we'll send some follow-up information which will include a link to those templates. So if you just go through that, that should pretty much cover most of the concerns and controls that you need to think about. So that's your legal responsibility, yes, under health and safety laws. And then you've got government guidance, which helps each sector try and interpret, what does that mean for me? So what are the potential risks, pinch points in a typical business of your kind? And then government within their sector guidance tries to give you some practical advice of things that you can consider to minimize those risks. So within the government guide, it's worth having a look to see if you can download the guide, because the PDF version offers also tick box checklists throughout the guidance, so that can make things easier. Guidance was updated just the other week. I haven't checked whether it's still including tick box checklists, so that may not be available on your sector guide. It's also worth looking at your trade association guides, because typically what we found in doing these talks to the range of sectors is that your own trade association has, tries to interpret and personalize advice just for your sector. They also do FAQs covering the main queries, concerns that they've come up from their members. So that's also worth having a look at. We're touching on mental health, numerous reasons for this. It interlinks with so many of the things that you need to think about as part of your risk assessment. Mental health, you need to consider it in terms of risk assessment because there's a requirement to do a staff consultation. And that isn't really just about doing a tick box exercise. You know, we now, a year on that mental health is a problem. Looking at and considering mental health in your premise will have an impact on practicalities of how people work. It will touch on the questions that we get from many of you around full capacity. When can we bring everybody back to the office? It also has an impact on productivity. You know, if employers or your staff are stressed, whether they're in or out of the office, that has been recognised to have an effect on how they work. Now, consultation was a legal requirement, but you shouldn't be doing it just simply because of the law. There is quite a lot of employees that have anxiety about returning to work. So if there isn't a proper consultation, letting people know what measures you're looking at to keep them safe, that will possibly cause conflict between employer and employees and may lead to peer conflict as well. Just to give you a feel for, what's kind of happening out there, which some of these will be relevant to your employees. In a normal year, 1 in 4 of us is experiencing some sort of mental health problems. But now, because of what's been happening in the last 15 months, the mental health bodies are saying we're suffering a mental health epidemic. Now, that may sound like an exaggeration if you look at some of the employer or trade body surveys. So you may have done your own surveys, depending on how big your business is, and those typically show the normal figures that about 40% of people are saying they're concerned about their mental health. It's worth just highlighting, if you have done your own survey and you can rely on that to think whether you need to consider support for your staff. Most people don't like talking about mental health, and as you can imagine, most employees are reluctant to tell their employer that they are suffering in some way mentally because of the stigma around that. So it's worth, I'm going to give more information on this in the follow-up, but this is perhaps closer to the reality of what your employees are feeling. 70 to 90% of working mums or men who will be working for you have been experiencing stress, depression, anxiety. So this obviously has an impact on everybody. You're trying to run a business. You're obviously need to think about your own health to help make sure you're making the best decisions and you can focus on driving your business forward. But it's worth bearing in mind these things for all your staff who will have these concerns about financial issues, isolation, fears around the virus and serious illness. Now, the financial concerns, we're going to signpost you guys to financial help, so that will deal with that. Isolation, thankfully, we're now starting to reopen, so that will deal with those issues. The fears around the virus will be around for many months, probably after the sector reopens and even at the point when everybody comes back to work. There is a lot of fear generated in the media. Unfortunately, sensationalization sells, so you don't always get a more rounded kind of picture of the issue. And I just picked up one example here. You may remember this super spreader event at beaches when we all reopened in the summer. There's a lot of sensationalization that you can't go out, you can't go down the beach. It'll lead to all these horrible super spreader events. Whereas if you look at what the government scientists said afterwards, it's minimal risk in theory and actually non-existent in practice. No examples of that happening anywhere around the world. The other thing that's, these concerns and feelings that I was talking about, everybody's got them. We're all seeing the news. But again, give some context, and it will touch on what I mentioned later about risk and risk assessment. Most people, when surveyed, say they think people in their 50s or 60s are the ones that are at risk, whereas the average age of somebody dying from COVID is 82 and a half, and the average life expectancy in the UK is 81. So it is still, as we were told at the beginning, it is the most vulnerable, the elderly at most at risk. So most people, and these are the ones that are coming to work for you, will have these concerns, but there's ways that you can do, you can kind of alleviate those concerns. And looking just in the context of working age people, which will be your staff that are may have concerns when you start to talk about bringing more of them back into the office. And I know many of you have talked about wanting to work as normal and have full capacity at the office. In terms of working age people, just over 500 working age people without underlying conditions died due to COVID in 2020. So that is, you're looking at 2 to 3 times more likely to be die in a car accident than you are of COVID. So that gives you some perspective that unfortunately is missing in much of the media stories that they like to push out there. You'll get some follow-up information about apps that are useful for employers to share with employees, contacts, groups for various adults and young people. Bear in mind, although working age people may be coming and working in your office, they will have families, they will have young people. So it is worth looking at mental health in a very rounded fashion. So that's quite a lot there, but you're going to see how it links in with other things that we talk about. So practical tips to reduce risk indoors. We've heard about UV lights, cleaning, ventilation, social distance, and mask screens. So let's talk about those each one at a time. UV light, you may have seen there was comments in the media that 90% of the virus can be killed off in the sunlight.
Paul,
yes.
Paul, I'm sorry to interrupt. This is Ellie.
Hello.
Do you want to share your presentation at this point?
Whoa, I'm very sorry. Very sorry, guys. Sorry, bear with me 1 minute. Okay, can you guys see that now?
Yes.
Okay, there has been slides all the way up until now. Do apologize for that. You will get the information that I've been running through in much more detail. Obviously, we can't go into detail about any things we talk about to any great extent within an hour. So you will get a lot of this, so you can do a deep dive in it later. Okay, so some businesses have asked about, will we buy these UV light sterilizers? So you see in the picture here, there's UV lighting in the ceiling. Some businesses have asked to bring those sorts of things in. There is a lot of scam UV lights being sold online. Those are not safe to use, as well as killing the virus. They're harmful to humans, so that's a big no-no. Cleaning, obviously we've been told about cleaning right from the start. The advice on that will probably change in the guidance in months to come. What the scientists say now is that transmission on surfaces is virtually impossible. Again, you can get the detail on why in the guidance. There's no reported cases of this happening. Therefore, excessive cleaning isn't going to be something that you should be focusing your resources on. You still need to do all your normal hygiene practices of washing hands, cleaning things like doorknobs, etc. Your normal cleaning within the office, but excessive cleaning was really only important if vomite surface transmission was seen as a real risk. So you may have in your office, you might have clients that come to waiting areas, so that touches on that. Do you still lay out magazines or drinks in those waiting areas? That is fine. In terms of, there isn't a necessity to use reusable cups. You just wash cups as normal if different staff, different customers are using those. Obviously, in the context of staff, bearing in mind, every office will be different. You may have had a shared set of cutlery, crockery before. Because of staff anxiety around the health issues, some may be more, wanting to come in and use their own cup. So things might need to be, this is kind of level of detail you need to consider in everything about your normal ways of working before and how the anxieties of staff, even if there's not a real risk there, staff anxiety will still mean that you need to consider these things. And it might just be that you need to inform your staff why you're going to work in a certain way or the same way that you used to work previously in certain regards. The key thing with reducing risk indoors is ventilation. So aerosols can remain, floating around in the air for several hours in an unventilated space. A study looking at a different airborne virus in a different country found that just only by improving ventilation and bringing it into a certain level, that they reduced transmission by 97%. Yeah, so it's a huge area that you should focus on within an office. Again, in terms of any questions around what does that mean in practice, what does good ventilation mean? You may have air conditioning units and want to know how many liters per second, what kind of rate you need to have your aircon on at. That's picked up in the detail that gets circulated. Ventilation, also you get a link to some guidance from aerosol air conditioning experts, which gives 15 practical tips. It includes things like answers questions around can you use fans, can you use aircon. Those are fine as long as the aircon isn't just recirculating the air. It tells you to focus on things in the unventilated spaces. You might have basements, you might have rooms where it's impossible for you to get good ventilation. So you need to think about limiting or stopping staff spending time in those areas. Toilets are usually an area with poor ventilation because usually you don't have windows. That's another area to consider. PP, do you need to wear face coverings? It's not a legal requirement. It's not appeared in the guidance because obviously it's the context is staff are working there 70 hours. Plus, if you have ventilation, and I refer you to the example in the gym sector, gym users never had to wear face coverings. And the reason is SAGE and Public Health England came along, looked at particular gyms and looked at the level of ventilation. And they said, as long as ventilation is slightly better than what we're requesting in the likes of retail and offices, then it's acceptable. It's minimal risk to gym users if the ventilation is a certain level. Face shields and screens are really relevant in terms of stopping large sneeze cough droplets, but they don't do anything about these tiny speech aerosols. When we talk and breathe out, those are the ones that float around the air for a long time. So your screens or face shields don't stop that. It's ventilation that helps reduce that risk. If you use gloves before for handling certain materials, chemicals, you would still use gloves now, but you don't need to use gloves, just because of COVID. As I say, that was a concern when we thought vomite surface transmission was a big issue. And gloves are not recommended because of the false sense of security they can give the wearer. Now, you might have an office where you can't, you haven't got access to open window and doors. Maybe you haven't got aircon. So you might be thinking, and even if you have, you might still be considering where do people sit? How far away do they sit from each other? So bearing in mind, there's two key factors that help facilitate transmission between different people. One is viral load. How much does somebody breathe in of the virus particles? So it's not just simply a case of if you stand next to somebody from 1 meter away, and they've got COVID, that you get it. You need to be near them for a certain level of time for them to breathe out the virus, for that a second person to breathe in. So this is why time is a critical factor. You know, they say if you're around near somebody, and that's less than 2 meters away, for 15 minutes or more, that is the point that you need to be considering, you know, some sort of risk mitigation measures. For aerosols, I've mentioned that, large droplets. So in terms of large droplets and to some extent the aerosols, seat configuration will be, you know, something that you need to consider. Previously, you may have had somebody, staff sitting, you know, directly face to face, a meter and a half away, depending on your setup. You need to, wherever possible, you're trying to get staff to sit side by side, because when they're breathing out, the particles are going forward. Or you're looking to sit them back to back wherever you can. Screens, you know, is likely a consideration of yours. As hopefully I've touched on earlier there, if the ventilation is really good and you've already considered seat configuration, you're not, you know, you don't necessarily have to buy screens. It will completely depend on your setup there. In terms of questions around when can you get back to normal, when can you bring in all staff to full capacity, there is no set number of how many staff you can have in an office. Each business needs to make their own risk assessment. And this touches on, you know, what part of the reason why I went into a bit more detail on the mental health section, because you look at the risk in comparison with many other things out there that we all look at risk controls for, and the risk to the average working age person is, you know, very minimal. Even if somebody gets the virus, most people will not display any symptoms and they will not suffer any great illness from it. So these, when you look, this is all about risk control. Yeah, you need to think about these things to reduce the risk as much as you can, you know, out of everything you're doing, focus on ventilation would be my key takeaway from today. Staff testing is something that businesses are thinking about. There is a link there for employers to order lateral flow tests. Employers can also, and there is some offer happening now where sectors can get free tests sent out from government. Whether or not you get those free tests, and after that free test offer goes, there is on the open market access to PCR and lateral flow tests. You may be wondering which one you should buy. So it's worth bearing in mind, PCR test is very, very sensitive. It picks up those who have minimal virus inside them, so are not at risk of transmitting to others. And also, some scientists have said it even picks up fragments of the virus. So somebody that might have had it and their immune system dealt with it, they may still show as being positive if you have a PCR test. This is why the likes of World Health Organization have been pushing countries to look at lateral flow tests, because those actually look at not just yes or no, have you got the virus, but have you got, you know, what are you likely to be at a level where you're transmitting to others? And that happens a little bit before symptoms and a little bit after the onset of symptoms. Vaccinations, you know, you may see some employers talking about they're going to change their staff rules to make sure all the staff are vaccinated. And other sectors have been thinking, will we have days where we allow vaccinated customers in versus non-vaccinated customers? So you know, those things are out there in the media. You would have seen them, and you may have these same kind of quandaries yourself. So two things to kind of think about here. One is looking at the survey of around 70,000 people, some of which will be, you know, your typical staff. 19% of working age people 30 to 60 said they feel that they don't want to take the vaccine, and around 29% of young adults who may be working in your office are also thinking that they are unlikely to take the virus. So you need to bear in mind there is still fears and uncertainty around there. So if you were considering bringing any mandatory policy for staff, you're going to come across some of those people that are very anxious. That's one thing, which will obviously cause conflict in the office. And the second thing is, as you'll pick up in the link that we signpost you to, there is a range of potential legal arguments around discrimination, human rights, etc. So that's for staff. Similar potential legal hurdles may come up for customers. So you may have waiting areas and be thinking, will you have some sort of policy that deals with who can come into your waiting area? So there's a range of legal and ethical problems around that. To let you guys know, there is some things being done around this. So government did a 2-week public consultation that just ended the other week, asking what people thought in terms of the ethical and legal quandaries. So government is having a look at this, whether they change laws to make it mandatory for people to have testing or to have the vaccine. So what I'd say is hold fire, don't try and implement anything yourself, wait to see what comes out nationally from government in that regard. There is some changes around QR codes. That's mostly relevant to all the other sectors. The NHS guidance was saying it may be something that you may need to consider if you've got high number of external visitors coming into a certain area. Then you can consider it, and if you need to do that, there's a link there. Bringing customers back, perhaps less relevant to you. Again, there's a whole mix of people watching this. So again, this is for those who have clients coming in. You may find that remote working remote communication with clients is working great, but some customers still like face-to-face, but they may still have these fears about coming back. This is why it might be relevant for you to have some sort of information on your own website that's easily accessible to your customers, to tell them about what steps, measures have you put in place to create a safe environment for them to come and visit. Do bear in mind, not everybody, customers or staff, is comfortable talking about these concerns they may have. So you may think you've done everything right, you've done followed all the guidance, everything is safe. But if that's either not being communicated effectively enough to all your staff or clients, or they may not feel comfortable telling you that they still have those anxieties, this is why it might be helpful to do some sort of anonymous feedback. Financial support. So this is a bit of a minefield, appreciate that. If you go to this link, just by filling in 5-6 questions on type of business, number of employees, you will get signposted to all of the relevant financial support that's available to your business. So very good place to start, and that will tailor the answers to the questions you answer. There is also a fairly new government recovery advice service that was set up several months back, which gives you free or cheap access to accounting, advertising, HR advice. So that's another kind of practical measure that's in place to help businesses to restart it and survive. It's worth probably mentioning self-isolation rules. So again, there'll be a link to give you all the details and what gets followed up. But just 2 things I'd highlight. One is, staff need to isolate. You need to consider sick pay, like any other illness that they may have to be off for. And there is a government £500 support payment for those that need to self-isolate to help, them comply with those requirements. You need to also think about quarantine if your staff are traveling. So have some policies around that. Think about that if that comes up. In terms of further help, as I said at the beginning, we cover those 3 London boroughs. So if you are watching this online and you're a business based outside Richmond, Merton or Wandsworth, please contact your local authorities, Environment Health Department for further advice. So I'm going to, there's one other thing that we wanted to mention, which is around for Richmond customers, Richmond businesses rather. I ask Ravina or Angela to pick that up, so we make sure we give you the right information on that. So that's it from me. We're going to open it up to questions. This can be to either of us in trading standards. We've got health and safety officers. We've got economic recovery team on board. So any questions about any of this, then please raise your hand and or put something in the chat. Now, while people are thinking about that, Ravina or Angela, could you just remind me the offer that's been made to Richmond businesses?
Hi, Paul. Hi, everybody. It's Angela. Just to say that if you're a Richmond business, the email that's going to be sent out by Ravina later today is actually going to give you a link to the Visit Richmond website, where you can be promoting your business for free. And then also, if you have any of the businesses that have got independent businesses within who are unique and special, then they can also be doing an offer on the Richmond card. But all of that will be on the email that will be sent out later today. Thank you.
Thank you. And is there anything else, anything extra any of my other colleagues in the panel would want to mention before we open it up for Q&A? No, fine. Okay, so appreciate that's a lot to take in. We were trying to summarize it more to give you guys more room for questions. So anything that comes up, practical considerations, things that you're thinking about, measures that you want to put in place but not sure if they will adequately cover Practech staff, please mention it in the chat or raise your hand. And just to again remind you guys, everybody's muted at the moment, so you need to raise your hand if you have a question. Okay, so when can offices open is one of the queries. So offices were, so the rules or guidance changed on the 29th to talk about rather than staying at home, you can stay local. So because of that, there's likely more staff that are thinking about returning to work, or more employers able to do that with that change in rules. Offices are open, have been open since the start. There's simply been an emphasis on encouraging staff to work from home. So this has been from the start. Staff should have been encouraged to work from home as much as possible, only where their job doesn't allow them, and this would include things like there isn't the technology in place to allow them to work, should they then be coming into the office. Does anybody else want to pick up or expand on that? Yeah, so it's all about minimizing the risk as much as possible. We're trying to minimize risk. So as my colleague mentions, if it's essential for your business for the office to be open, then you then just need to consider do the risk assessment and think about how many people can come into that space safely, bearing in mind everything we've discussed about making sure ventilation is good, and the other things that were mentioned.
Can I answer that question, Paul, from Penny?
Yes, please do.
Hi, it's Helen Clark here. With regard to your staff living further afield, it's whether or not you need the staff in the office. Offices haven't, as Paul said, actually ever been fully closed. It's just the government advice was for people to stay at home as far as possible. But if you need staff in the office for various reasons, you've got new starters for training, for whatever reason, then they have always been allowed in. You just have to accommodate them safely. Yeah,
and so it is probably if part of the staff concern was, oh well, we're not allowed to go to work because it's too far away. They're worried about being stopped and questioned by police, etc. The law has always enabled people to go to work as long as you had a reasonable excuse, was how the law was phrased. If it was reasonable and you needed to go into the office, even if it was far away, then you were allowed to do that. I guess what's the change is now is that we're now opening up more. So it's now, now more and more people, I think it's 99% of the most vulnerable population have been vaccinated. Some of those may have been in your employees. So that's a big change that's happened. And, obviously it's part of the government's roadmap to open up different sectors. This is why more and more offices will now be thinking, well, now that these measures and steps have taken place, we can now start to ask staff to come back. But you should still, be thinking about staff working from home if they're able to do so. But if they need to come in, that they need to come in. You just need to do your risk assessment and minimize the risk. Any other queries? Either raise your hand and you can, we'll unmute you, or just mention it in the chat.
Can I just ask what Mariella means by an internal vaccine policy? Is this for your own staff? I don't know whether we can unmute.
Yeah. So this is, what I was mentioning earlier, that some employers have started to think about, will we have some sort of policy that, requires certain staff or all staff to have a vaccination before they come into work. The two things that you need to be thinking about. One is the legal and ethical concerns, and that's something that government is looking at. But the other thing is the risk. Like everything, even if it was legally something that you could do, in terms of thinking about that as a risk control measure, you need to look at what is the risk. And the evidence, the official stats from official ONS is that just over 500 people in England and Wales of working age without underlying conditions have died from COVID. 3 times more people die in a road accident in the UK every year. So there's lots of ways you can compare that, but that when I came across that stat myself, that's when it really kind of, in my mind, really gave me some context to this. Not a lot's changed since what we were told at the start, that for most people, unless you're vulnerable or unless you have some sort of underlying condition, you are not at risk from the virus. So I fully appreciate, lots, you as employers have the same concerns everybody else has when we've been, in this situation the past year of this constant fear that's been around for over a year. It's going to make us anxious. But really the risk is very minimal to the average person, 18 to 60, that will be working in your office. You may decide, and say government does change the law, and this is something that they're looking at, that will be the time to think about changes in policy. But again, it shouldn't just be a black and white, everybody now needs to be vaccinated. It needs to be proportionate. So maybe if you've got vulnerable adults, people with underlying conditions that work for you, you may then be thinking, well, maybe I need to have a policy in place to protect them. So that there is loads of issues. There's the law, then there's the ethics. Should you force employees to do something that maybe they don't want to do?
Sorry, Paul, it's Angela.
Sorry.
Hi.
Yes.
I just was wanting to know if Mariella wanted to be unmuted. So I've asked her to unmute herself.
Oh, Mariella,
no, I'm
you're
okay,
unmuted.
thank you.
You're fine. Okay,
Just
that's
answering
brilliant.
questions now.
Okay, thank you. Brilliant.
Hi, Mariella. I think unless you're working with vulnerable people, it's not likely to be an issue for you.
Okay, completely makes sense. Thank you so much. Because I think
Okay.
I've heard of other companies potentially starting the process of initiating some sort of internal policy, and I just thought maybe would we need to start doing that as well?
I don't think you don't need to start to, and I think, as Paul said, you're on quite sticky ground if you're going to start making it compulsory, unless there is a risk associated with the work that they do. And in an office, and as I said, unless you're meeting vulnerable clients, that's unlikely to be the case.
Okay.
Yeah. And again, just to give a little bit more context, it's really unfortunate. This is the world that we live in. There is a lot of sensationalization in the media. So if you actually look at this situation about vaccination policies, most trade sectors and the professional bodies represent all these different industries are really against, making it mandatory for staff or customers to be vaccinated. And there's the odd one employer that then gets splashed across the media that was considering this, but they are very, very much the minority of employers. Most employers are looking at this, in terms of risk, it's low, and do you want to be getting into ethical, legal challenges? And even that aside, do you want to have that conflict between you as an employer and employees when there is, very, very little risk? As I say, if you're concerned about vaccinated employees, you'll need to have a policy to stop people driving, because they're 2 to 3 times more likely to be die in a car accident than they are to die of COVID. So, put it in perspective is what we need to do for these things.
Great, thank you so much.
Will you share the slides? So what we have is we're recording the presentation. So this will go up on all 3 council websites. You will then get follow-up information. More important now with this webinar, because unfortunately I didn't realize I hadn't shared the slides at the beginning. So you will get the detail and all the things that we've been speaking about. So, and we think the follow-up information probably, the webinar will go online on Richmond site at least on Monday. But we then need to share it with the other 2 councils that we are partnered with, and I would expect, within 7 days it'll be on the other 2 council websites. The follow-up information that should come out in terms of the detailed information, hopefully within 7-10 days tops. That will be emailed to everybody that was registering. One of the other comments within the chat, let's just have a look at this. Yeah, so somebody else just mentioning in terms of hesitancy, just adding a little bit more to what I mentioned in there in terms of some staff not wanting to take the vaccine. So even if the law gets changed, one of the people listening has just mentioned about the 16 to 29-year-old group being very hesitant, and they mentioned ONS, that's Office of National Statistics figures, talking about 17% being hesitant. The survey I referred to was a survey of 70,000 people, so different from ONS, that's been done in terms of it's looking at everything: mental health, people's attitudes to vaccinations, certification policies, lots of things to do with coronavirus. So it's a significantly substantial amount of people that's been surveyed, and that showed about 28% of young adults under 30 said it's, for them, they think it's very unlikely they'll take a vaccine. So that's what they're feeling. And also bearing in mind, all the signs tell us that age group is low risk. The younger you are, the less you are at risk. This is a risk to people that are elderly. The average age of death is 82.4 years old. Yeah. So the average age of people that die from this is a little bit higher than the average age that people die in the UK. Yeah. So yes, we will send out the follow-up information so you can get that. And by all means, use this when you're trying to share and put your staff's mind at ease. Because these concerns that we hear from in the webinars, we've done 4 now, and we talk to businesses week in, week out. We're hearing these same concerns from many businesses in different sectors. And it's exactly the same concerns that we had as individuals. So I was one of those people that was anxious and telling my family and kids to have the face masks on, and talking to restaurant owners when I went out for a meal, asking them about the ventilation. So it is normal in this very strange times, and when we are having that fear week in, week out, and seeing the number of people dying, it is natural that we will be concerned and anxious. And these are the thoughts that would be going through the minds of your employees. They might not tell you that, but all of the surveys say, mental health has been severely impacted from everybody of every sort of age group for numerous reasons. So other questions in the chat. Will the follow-up include the resources you mentioned? Yes, it'll include links to the templates, detailed government advice, reference to the surveys, yes, so you can do a deep dive on any of that information that you want. So the detailed information that we'll give is, anything that you want to get into that we've talked on about, you'll get in the follow-up information. And also, if that doesn't answer your questions, I'll just also highlight for those businesses in our 3 boroughs, you can email foodandsafety@merton.gov.uk, and that will be picked up by one of the regulatory staff, so they'll be able to answer that. Any detailed questions that aren't answered in either the government guidance or the follow-up information that gets sent around. Any other queries, concerns, comments? No? Fine. Well, if my colleagues haven't got anything else to add, we will close up there then.
Yeah, nothing further from me, Paul. And as you said, if you have any queries post this webinar, it's foodandsafety@merton.gov.uk, and we're all here to help you.
Great. Thank you for attending. Yeah, best of luck with your business moving forward. Thanks. Bye.